So much has been said about the horror we witnessed outside Union Station last month. The panic, the pain, the push for change in the wake of what happened. But let's take a moment of pause to remember the people, those who ran toward the danger and worked to prevent further loss of life.
All right, we have 7 gunshot victims, 2 critical. Actually, make that 8. They just keep coming in.
We have 3 ambulances staged, ready to pick up victims. I think we're going to approximately need 5 more.
First responders scrambled in the moments after the shooting, rushing victims to nearby hospitals for help. Thankfully, they were not far away, just up the hill from this mass gathering of hundreds of thousands of people. Doctors and nurses at Children's Mercy Hospital and University Health put their training into action, prioritizing patients, young and old, as they kept coming in.
We have to first triage them up front to make sure the sickest get care first.
We started putting greens and yellows in the front of the tent and reds in the back. We received a belly wound, a butt wound, a head wound, multiple extremity wounds.
Many of the injuries were life-threatening, so there was very little time to get patients stabilized and sent to surgery. Medical staffers followed their mass casualty plan. It is something they trained for quite a bit, just in case the worst happens here at home. Here to get to the heart of this response, please welcome Dr. Dustin Neal, Trauma Medical Director from University Health. Thank you so much for being here. First off, a heartfelt thanks to you and your team for everything you do and did that day. Your people treated a dozen patients, many of them badly hurt. Walk us through, kind of peel back the curtain for us. When you get the call, what is going on? Do you know how many people are coming? What happens behind the scenes?
So we get an update that there was a shooting or a mass casualty event. Unfortunately, the numbers are always sketchy. You hear large numbers, a large number of possibilities. And so when that happens, our mass casualty plan gets enacted, and everybody reports to where they've been told to go and where we've practiced over and over again to go and wait.
Mm-hmm. And this is an emergency that you drill for.
Correct.
So what does that mean? How does it change a normal day-to-day at the hospital?
So obviously that day it was a normal day at the hospital, although there were people from our hospital at the parade itself. But our day, the hospital's running just like it normally does. We have 8 operating rooms. All of them are actively running. The interventional radiology suite is running. Everything is busy. And then all of a sudden we find out that we may have up to 12, 20 patients coming. And so we have to make space for them quickly in order to accommodate their injuries immediately. Mm-hmm.
And as we just heard, a little bit of triage too, to try to see who needs to be treated right this second.
Right, correct.
University Health is a level 1 trauma center. To the normal person, we just know that means you guys are prepared, but what does that mean?
So Level 1 Trauma Center is a national certification that the American College of Surgeons gives hospitals that meet certain criteria. There's a state designation Level 1, and then there's a national designation Level 1 that's identified by the Committee on Trauma. That requires us to have certain things available, certain things ready at all times, and one of them is a mass casualty plan. Our recertification was in December, and one of the main things that they actually wanted us to talk about was our mass casualty plan, and it's something that every Level 1 trauma center has to have.
Does that involve, the training involve like a mock event when you do that?
We have multiple what we call tabletop events where we talk through possibilities over and over again, who's going to go where somebody's going to show up, because when something happens you have to be ready, because again, we need to know what to do because we never know when this event is going to occur.
Sure. And of course you fall back on the training, you drill it in, it's second nature. But there has to be an emotional toll here, especially with something that is right down the road from your hospital.
Right. So the actual training starts in what's called ATLS. It's Advanced Trauma Life Support. It's a class that everybody that works in the emergency department as a physician or a physician extender has to take. One of the things we actually do in that class is triage scenarios. It's one of the things that's required for that class to be passed. And so we actually start at the very beginning of somebody's training, knowing when to triage and what goes where first. After that, when they arrive, everything has to fall back to your training of what you've been practicing over and over again. Again, I've been doing this for going on 11 years, and so we've been practicing for 11 years. We have a mock citywide trauma every single year that involves all of the hospitals in the city. And then when that happens, that we actually had to enact the policy, and the program, everybody did exactly what they were supposed to do.
There's an emotional component, though, isn't there? That you kind of have to fight back a little bit.
You do. In the moment, you fall back to your training. It's the aftermath when the dust settles and you realize everything that you've done to take care of people, and then you start thinking about all of the lives that have been affected, both the lady who lost her life as well as the 22 other patients injured from the gunshot wounds, despite the emotional toll of all the people who were at the parade, running, scared for their lives, trying to take care of their children, get them to safety. And then our hospital is obviously, as you mentioned, right down the road, and so we get the brunt of most of it. And then when the dust settles, everybody's, well, that could have been me, it could have been my family. And we as the hospital have no idea what's going on at the parade. The cell phone service doesn't work, so nobody can check in on their family members either. And so we're trying to take care of people we haven't met and hoping that our family members are okay.
Right. I know it's a very extreme emotionally charged time for everybody, but we appreciate everything you and your staff did. Dr. Dustin Neal, thank you so much.
Thank you.
KMBC 9 News will continue to follow any developments from the Parade Day shooting. You can watch our reporting on air, online, and through our KMBC 9 News app.